All right. So as usual, we are recording the session and we will be putting the slides that we're showing today and the video recording of today's session, and also the chat will be recorded. The chat we won't make publicly available, but any of you who are here can just email us and we will send it to you. And the video recordings and so forth will be on our website. And after the seminar, on probably on Monday when we've processed the video, we will send that link out to you guys so you know where to find it and you can look at it anytime. And I think without further ado, since we have a lot to discuss and cover today, I'm going to get started. I'm going to do a quick intro of our overall project, and then Dr. John Kelly will be introducing our wonderful presenters today. And just to remind us, this is now our 4th seminar in our series funded by NIDA to advance the science on recovery community centers, and specifically on how these recovery community centers can support persons treated with medications for opioid use disorder. If you go to the next slide, Hazel. And our goal, so this is a project that runs for 5 years, and we are into, a little bit into it at this point. We have 2 major goals, and the one is to engage recovery community stakeholders in research advancing activities. And that is this seminar series. It is pilot funding, it's advisory board meetings, it's hands-on support, all of those activities. And then of course, you guys tell us what else we need to be doing. But our idea is that there's many people, multiple stakeholders that are involved in this. And we really want to be in conversation, developing the science on recovery community centers together. And as we're going through these activities, what we do is we disseminate tools and products on our website for everybody to see and everybody to build on. So I mentioned the video recordings. We're also collecting other products and tools like papers and reports. And all of our presenters usually have supporting materials as they're speaking about things. And all of those things are being collected on our website that you all get the link for so that you can all use them. Next slide. This is our steering committee. We are made up of a group of scientists, clinicians, RCC leadership, and persons with lived experience. Many of us are from a recovery community, Recovery Research Institute, but we're also from other institutions across the US. And if you are very closely paying attention to this slide in the past, you will notice that one of us is no longer here. Go to the next slide. And that's because Mr. Tom Hill has moved on. He's no longer on our steering committee because he has accepted a position as the Senior Policy Advisor for the White House Office of National Drug Control Policy. So we just wanted to say huge congratulations to Tom. He's been absolutely fabulous for this project and of course for the field. So we are very excited that he will be doing even greater things in this new role. Next slide. This slide you have seen before. This is about the resources we are hoping to develop and share with you all. And we've color-coded them now to show you actual progress. So in green are the things that you already have access to, the video recordings of our seminars. And what we've also started doing is we're trying to really get scientists and RCC folks to work together and find new connections to help each other out. So we have created a list of RCCs who are willing to interact and work with scientists so scientists can find you. And we also want to post any kind of other linkage information that's helpful there. So on the bottom here, you now see a new website. If you go to that website, you get to our landing page that gives the mission statement for what we're doing. And then on the side, on the right-hand side, you will find tabs for all of these things where you can find further information. The thing in the yellow, oops, sorry, go back to the yellow. These are the things that are now open for applications. We are now calling for applications for a conference presentation. If you think about a scientific conference you want to go to and present on RCCs, please do so. And there's travel funding available for you to help you go there and present, including during the pandemic, audiovisual kind of stuff that you might need and registration costs to cover, so you can do that. We're also opening our call for pilot studies. And please know, we have all materials online. So there's all the application forms. We have the online forms for where you put it into actual database for your application to be processed, and so forth. And we have everything hopefully organized. But if there's something in our materials you see that doesn't make sense to you, but you have questions about, know that this is our first call. We'll be learning as we're going forward. So do give us feedback on that as well, so we can make it better for the next cycle around. But these things are open now. And if you go to that website down on the bottom, you'll get there. Hazel? So here is what it would look like if you click on the link, the funding for pilot studies, what the award is, eligibility, and then on the bottom, there's all the supporting documentation you need for it. And next slide. Next slide, Hazel. The same thing for the conference travel. about what you would get and how it's processed. And then on the right-hand side, there's even a screenshot of what the online application form looks like to complete. All right, that's what it looks like. The other thing we wanted to start doing with you all is just kind of share recovery happenings. When we meet as a steering committee, there's a lot of excitement and energy, and we share resources that we've heard about, and we thought we should share it with all of you. Things that are recovery related, that are interesting, exciting, motivating, or helpful. And here we have a couple of those. So in Massachusetts, there's new recovery coaches training and curriculum available, and we give here the website where you can go to get much more information on that. And Julio Ojeda, who's on our steering committee, shared that with us. We want to be sure that everybody hears about it. We also want to share that at the Recovery Community Centers within Massachusetts are actually going to be participating in a statewide 3-year evaluation and science advancing process. It's going to be headed up by Dr. John Kelly here, and at the Recovery Research Institute, and it's going to be a collaboration statewide with all the RCCs, which is very exciting. And we hope to be sharing our lessons learned and process along the way. And then if you guys have information to share with a group, please do so. Simply send us an email and we'll put it on the website for everybody, and then we'll collect happenings as they go. So there's a nice hub for people to find information they're interested in. All right, that's it for the project. What we need to do now for housekeeping is just do a quick Zoom poll on demographics of who's there. And then I'll turn it over to Dr. John Kelly. Oh, wrong poll. That's okay, we'll do this one. Oh, it has, okay. So we'll do this poll, and then Dr. John Kelly will introduce our fabulous speakers. And make sure you scroll down, there's multiple questions. And then click the submit button at the bottom.
I don't have the poll.
Oh, that's strange. It might be that there's some pop-up blocker maybe on your software.
It also might be hidden behind other windows.
I'll check.
It's not allowing me to submit. I clicked everything, but the submit button is not allowing me to click on it.
Yeah, I'm not finding it anywhere.
Keep scrolling and answer all the questions. Keep scrolling.
Yeah, it didn't show up immediately for me, but then it did after 30 seconds.
If you scroll to the bottom, I think the last one is on ethnicity, and then on the bottom it should say submit. If it still doesn't work, we'll look into it after the meeting to have instructions and trouble solving for next time. And while we're doing this, I just want to point out, we also have an interpreter for sign language here. So we tried to pin her. So any of you who want to see sign language translation for what we're doing today, hopefully you can see here. Her title here is called ALS Kelly. If you can't pin or can't find, we can give you directions to make that possible for you. All right, how are we doing on the poll, Hazel?
We have 78%, so I can end it if you're ready.
Yeah, let's go ahead and we'll try to solve trouble solve later. All right, John, over to you.
Excellent. Thank you so much, Bettina, for that great introduction. Hey, welcome everybody. So glad to have you or have you back. We have a great lineup today. I'm really privileged and honored to introduce my friend and colleague, Phil Valentine, and 2 of his colleagues, Brian and Rebecca. I've known Phil for many years. I first met Phil, I think it was about, I was just trying to recollect, Phil, when it was. I think it was about 15 years ago or so, down at Samsung. We were on a task to do a treatment improvement protocol on relapse prevention. I don't know if you remember that, Phil. That's where I first met Phil. And one of the things that really stuck with me about Phil right there and then that I've never forgotten is just how good he was at that time and still is at just engaging with people, just on the human level. And just I had the opportunity to observe Phil in interactions with recoveries or up and coming recoveries, as it were, in the context of this relapse prevention exercise. And I never forgot it because Phil was an inspiration. I never told you that, Phil, but just in terms of observing you with others was really inspiring to me. at that time. So, and you've been, frankly, an inspiration to me, and I know many other people in this field throughout your career. You continue to be a real role model and example, if you don't mind me saying that. So I'm so honored that you're here to share your experience with so many people out in the world. Let me give you a little bit of formal background about Phil. He is currently the executive director for the Connecticut Community for Addiction Recovery, or CCAR, which he's going to talk a bit about. I've had the great privilege of being down there. In fact, CCAR in Hartford was the first recovery community center I saw. That's why I got into this, was because of Phil's example and what he had done down in Hartford. Just an amazing place, full of compassion and love and hope. He's also an accomplished author, trainer, and presenter. He's won numerous awards throughout his career. In 2006, he won the Johnston Institute America Honors Recovery Award. In 2008, Faces and Voices of Recovery honored CCAR with the first Joel Hernandez Voice of the Recovery Community Award as the Outstanding Recovery Community Organization in the United States. In 2009, the Hartford Business Journal named Phil the Nonprofit Executive of the Year. He's also appeared in the Anonymous People movie, which I know many of you have seen. And he not only talks the talk, he walks the walk, and literally walks the walk. He's walked the Appalachian Trail. So he really does walk the walk. And, you know, Phil, thank you. And Rebecca, very nice to meet you. Brian, nice to meet you too. And I'll hand it over to you. Thank you all so much for coming. We'll have a presentation, and then we'll have time for Q&A and discussion for the last 15 minutes or so. Thank you. Over to you, Phil.
Thank you, John, and thank you for all your work in highlighting recovery community centers and what they can do. Hi, everyone. My name is Phil Valentine, but for the grace of God, I haven't had a drink or a drug since December 28th, 1987. So what was that, 2 months ago? I hit Larry Bird, number 33 years in recovery. Yep. Brian, you know all about Larry Bird. I know, being from Brockton. Yes, sir. The other part is that I started my career with CCAR in January of 1999. So it's been 22 years. So I've been around a while, you know, and I just kind of had some perseverance, continued, and am blessed now to share our presentation with Rebecca Allen, our Director of Recovery Support Services. She'll give her own introduction when it comes around to her. And my another friend and recent colleague that I recruited from the fine state of Massachusetts. Well, did I really recruit you? You just kind of applied. I don't know. But now he's in Connecticut, Mr. Brian Robbins, Senior Program Manager. He has a fascinating history with recovery community centers, from being someone who visited them to someone now who oversees 5 of them in Connecticut and had the same role in Massachusetts as well. So we have some experience to share with you. So let's jump right in. Let's jump into the first slide. And these are what we would call active ingredients. What is necessary for a recovery community center? And I'm just going to give a brief history of how we developed the first one. We were funded by the federal government under the original RCSP grant. I know there's a few of you out there. I think I saw Mary Ann there. She was one of them, from Massachusetts Organization of Addiction Recovery. And there's other people that have been involved from the beginning. So we were designated to put face on recovery. Bill White uses the term, offer ourselves as living proof that recovery is real. And we would be a vanguard of people in recovery, family members, friends, and allies that would put a voice on recovery. So we did that very effectively for the first 3-4 years I was at CCAR. Then the federal government changed their programming from Recovery Community Support Program to the Recovery Community Services Program. And they wanted to just do real recovery support services we went to the recovery community in Connecticut. They came up with the idea of a recovery community center. We opened our first one in 2004. The first lesson is recovery community center takes shape of the local community. They are the local community. So if we could have the next slide, side of our staff at a not this year's Christmas party. Before all you COVID people getting on me, this was a couple Christmases ago, and when we could actually like be in close contact or max. And you will see just one example of the diversity of our organization. It represents the community we serve, not only in appearance, but in types of recovery, about role in the recovery community. Like I said, family member, friend, ally, or actually person with lived experience in recovery, educational background, socioeconomic, very diverse. And that's what we hope the recovery community centers to be as well. Next slide, please. Our foundational principles are something we wrote, I wrote, I'd say 10 years ago, maybe 12. And I didn't have the first one, Recovery First. I had the other 5. And then it occurred to me as I was thinking about how we talk about the recovery movement, it's always about recovery first. Always. It's not about the organization, and it's certainly not about the individual. So if I ask Rebecca or Brian to go out and talk, they talk about recovery first. That is the message we carry. Bill White talks about recovery carriers, that we can go out and infect communities and turn the tide from addiction to recovery. How wonderful would that be, the idea of being infectious and carrying the message of recovery? The big lesson for me, and these are closely tied, are you're in recovery if you say you are. And we believe firmly in multiple pathways. You know, our 2 questions are, how can we help you with your recovery today? What does recovery look like for you? So we are not prescribing a certain pathway. This there is early in my career at CCAR, I was training this module called Religion in 12 Steps, Adversaries, Strangers, or Friends. And I had a couple guys, white men, 20 plus years in recovery in Alcoholics Anonymous. 2 Black women said they were in recovery 20 plus years, and a recovery ministry in church, light in their eyes, kind, compassionate men. And the 2 gentlemen from AA told them they were not in recovery, no longer attended meetings. I got to facilitate that discussion. And it really opened my eyes that people from recovered in a variety of ways. And after 10 years in personal recovery, I didn't need to defend that anymore. I was comfortable enough in my own skin to say, this is my pathway. What's yours? What does that look like for you? And another note about it, you are in recovery if you say you are. The only requirement for membership in Alcoholics is what? You said it. I heard you. I can see each and every one of you out there. You all said a desire to stop drinking. Who determines if you have the desire? The individual. You have that ability. So we always err on the recovery, err on the side of being generous, always focus on the potential. That's why I will say, my name is Phil. I'm a person in recovery, not the pathology. I don't say I'm an alcoholic or I'm an addict. Although if I separate myself from this role and go into my 12-step meeting, I may say, my name is Phil, I'm an alcoholic. That is what I do. Next slide, please. And this is my last slide. And I just wanted to give you like the briefest organizational structure blocks. This is straight from our strategic plan. And I want to point out one thing here that you'll notice what's in the center, and I'll get that. The foundation of any, and this is an organizational plan for a recovery community organization that's different from a recovery community center. Oftentimes those two are confused. The way we do it at CCAR is the community organization is the umbrella under which we operate recovery community centers. But in order to do that effectively, we have to have administration. And just frankly, because we're all friends here, I've seen many recovery community organizations that lack the administrative capability, but it has to be the foundation. And we do things like the actual administration, record keeping, data keeping, human resources, finance, technology. Our three big blocks on which we build are advocacy, putting a face in recovery, our services, which is the bulk of our employees. We're up to 55 employees now at CCAR, and then training. So we have advocacy, services, and training. And you can read the other bullets out in there, but simply put, the services are to build Connecticut's recovery capital. Anything else we do is for the people of Connecticut. We do that through coaching, telephone recovery support, all recovery meetings, volunteerism, and the bulk of those services, not all, but the bulk, the vast majority, delivered in our network of recovery community centers. Finally, we all report to the board of directors. I am the liaison between the board of directors and the board chair. The people on the board are not telling staff at CCAR what to do. I've seen that happen a lot. And there are no staff that serve on the board of directors. You can't do both in a viable nonprofit, for a viable nonprofit. Those roles have to be distinct between staff and the board of directors, who are primarily responsible for governance. Are we doing what we said we were going to do? And are we good stewards of the resources we're giving? The financial piece. So that's my little piece. Rebecca is going to talk, Brian's going to talk a little bit about the culture and the active ingredients of a recovery community center. And the last thought I'll leave with you is over the last 10, 12 years, and especially since I came back from the Appalachian Trail in 2015, we have spent most of the leadership focus on organizational culture. And ask yourself this question: what type of culture do you want to work in? Because my executive coach asked me that. What type of culture do you want to work in? And the next question is, are you? Are you working in that culture? And the other part you have to realize is you're either contributing positively to that culture or negatively. There is no neutral. So you have a big say in the culture in your organization, and you can institute change if you believe you can. And think of the culture you want to work in and work towards it. All right. I think it's up to you, right, Brian, my man? You're up next.
I think so. Thank you, Phil. So as Phil said, my name is Brian Robbins. I am the Senior Program Manager for CCAR. I also am a person that's in long-term recovery. I haven't had a drug or a drink since February 23rd, the year 2000. So yes, my 21st year is about 4 days away, which is something that I'm very proud of. I had this whole story in my head. Rebecca and Phil and I went over some talking points and wanted to tell a little story. I can tend to be long-winded. So what I want to say is that I am a person that his first experience was personally walking into a recovery community center when I had no idea what it was. I went into this center looking to attend a 12-step meeting, and it was something that was very new to me. But what I did know is when I walked in there, I felt an atmosphere of welcoming. There was a lot of laughter, a lot of talking going on. I was greeted at the front door, and I was asked if they could help me. And I told them I was there for the meeting. I'm not going to get into a whole long thing about that, but the atmosphere and the culture that I felt in that center was something that I had not felt before. Even though I've attended meetings and been in a recovery community, there was something about that space. And that space was in Brockton. It's a center that is still there, Stairway to Recovery. And from there, I was working in my community in Brockton. I was doing HIV work. And I used to walk into this center and I met the director. I believe he's on here today. What I didn't know at that time is this gentleman would become my mentor and my boss and help me to get to where I am today. He took me under his wing and he showed me about this culture that you see in front of us, some of these words. These words came from some staff that oversee our centers in Connecticut. I put out an email to the center managers and I said, when you hear the word Recovery Community Center, what's the first thing that comes to your mind? And these are some of their responses. Honor all pathways, non-judgmental, service, embrace all. And this is what we try to do for people in our recovery community. This is my hope for all that enter into a center, that they can feel the atmosphere of recovery when they walk in. When you walk into a CCAR Recovery Community Center, one of the first things that somebody will ask you is how can we help you with your recovery today? And hopefully from there, the person is engaged and has and is welcomed into this space so that they can take their time to find what they need. Some people come in, they don't know what they want from recovery. Some people are searching. They may not know what their hobbies, their likes are, how to be of service. And in these centers is where you can find that. Can we go to the next slide, please? So here is just a few pictures of the centers that we have in Connecticut. We have that range from one end of Connecticut to the next. So we have centers in Wyndham, Hartford, New Haven, Bridgeport, and Manchester. So my role as the senior program manager is to oversee those 5 centers and to make sure that these centers in these communities are offering what we would like people to take advantage of in our recovery communities. Can we go to the next slide, please? So this is the atmosphere. So this to me is one of the most important things that I believe a recovery community center can provide is this atmosphere of a place of belonging, a place where someone can feel included and supported in their recovery. When I ask people, so I was thinking about this active ingredient, and I stumbled over it for a little while about what is the active ingredient of a recovery community center. And the only word that kept coming back to me is recovery, which is different for everybody. Like I can't tell somebody what that is for them. I know what it is for me. For me, it was relationships, it was connection, it was being felt a part of, but that's not for everybody. For somebody else, they may just want a place where they can come and they can feel safe, where they can find a pathway to recovery. They may not know what they're looking for when they come into that center. But what I do know is if somebody stays engaged and continues to attend one of these recovery community centers, they will find what they need. I know I did. So I don't want to take up a whole lot of time. So at this point in time, I will share it and pass it on to Rebecca.
Okay, excellent. Thank you so much, Brian. I appreciate what you just shared. Very, very powerful. So my name is Rebecca Allen, and I am the Director of Recovery Support Services for CCAR. Phil shared that slide of our kind of organizational chart with you. And under my piece is I do oversee all of the centers as well as our ED recovery coach program, our DOC recovery coach program, and a bunch of other little things, right? So I have the pleasure this afternoon of talking to you about the fun stuff, to me, probably the boring stuff to you all. But if you could just advance the slide. Excellent. Impact. So in my travels, I get asked a lot, you know, how do you know that what you're doing, these services that you're providing, how do you know people are getting better, right? Or what are your success rates? I think it really comes down to, you know, how are you defining better, right? I like to define better as, are we helping people improve their health and wellness, right? And how do you show that? The terms better or success are going to be different for everybody, like Brian shared, just the same way that recovery is different for everybody. So is that definition of somebody getting better or somebody being successful, right? So how do we kind of show that, and how do we show the impact that our recovery community centers can have? And not just on that individual, but what about the family, and what about the community? So it really does have that rippling success, you know, that rippling effect of, if that individual is getting better, if that individual is improving their health and wellness, how does that affect their family? How does that affect their community? And more important, how do we show that to our funders? How do we show that to, you know, the people that are giving us money to provide this service? If you can just go to the next slide, please. Excellent, excellent. Thank you so much. So when you're talking about how do you show the impact that a recovery community center can have, I want to share with you some of the measures that we use at CCAR. One of the things that I really, really have to focus on is, I never want the collection of data to get in the way of engaging somebody. So I'm constantly looking at, you know, different ways we can collect data, but yet not turn people off of coming into the center. I don't think anybody wants to come into a recovery community center and do an assessment or do a survey of, 50 plus questions. So I want to thank Dr. Kelly, because the BARC 10 is a really, really great tool. I'm going to talk about that in just a second, but one of the easiest things we can do is we have a sign-in sheet. So when somebody enters one of our centers, they are greeted by one of our volunteers who is usually sitting at a receptionist area. And that volunteer asks them, how can I help you with your recovery today? That individual can say, well, I'm here for a meeting, or I'm here to, for this group, or I'm here to meet with one of the volunteer recovery coaches. Or many times that person says, well, I don't know. I'm not quite sure why I'm here. this person referred me, or, you know, I was just walking by and I was wondering what you guys do. But anyway, so, you know, after that conversation happens, you know, that individual is asked to sign in. And it doesn't have to be their full name. It could be their last name. It could be, you know, their first initial, last name. It could be their first name, last initial. It doesn't really matter what they use to sign in. What we ask is that, you know, that they sign in consistently, you know, every time that they visit. But you can look at very, very basic things and tell a story, right? So you have data, but it's really how you tell the story of that data and how, you know, what narrative you're talking about. So very simply, I look at the number of visits and the number of individuals. So last year in 2020, you know, throughout our 5 centers, we had 14,561 visits by 5,288 individuals. You know, that was during a pandemic. So you can see that people still needed that in-person engagement. Although we did a lot of virtual support during that time, as soon as we were able to physically open our centers, that's what we did. But you can look at something like this, and here's my narrative. You know, if I kind of do some number crunching, just very surface level, I could say that each individual visited the center, you know, at least 3 times, right? In the last 12 months during the year 2020. If I looked at it a little bit more, I could also say that, you know, in this particular center, volunteers were engaged because I could see that there were a large number of visits, but by a small number of individuals. So that tells me that those individuals, you know, visited that center frequently. But that's one story I could tell. Another story is with our volunteers. So we have a very strong volunteer culture in our centers, and we do have a formal system to kind of track that. So I can look at the number of volunteers versus the number of service hours. So again, last year in 2020, we had a total throughout our 5 centers of 238 volunteers, and they contributed, you know, almost 18,000 hours of service, which to me, again, during a pandemic was incredible. We do some volunteer surveys, but again, we really want to do the surveys with our volunteers, you know, so we're not asking everybody that is just visiting the center to do a survey. We could, and again, you know, I'm so excited that the Recovery Research Institute and Dr. Kelly and his team are really looking at different ways to you know, do some of this research and you know, get some of that good data that we can all use to say, you know, listen, these centers work. These centers help people. These centers help, you know, on a community level. They help build that community level of recovery capital. Again, group meeting participation. We do ask people to, you know, to sign in for a group. We pass around a clipboard. And again, we're not asking people to, you know, sign anything more than their name, and it could not even be their full name. But we do track things like that, and we can, you know, get data from that and tell that story that, you know, people are engaged, they come in, they attend meetings. And the BARC 10. So, you know, what I really love about the BARC 10 is that it is a very simple tool, but it's quantitative. So you could take the answers and convert them to numbers and get a score. And if you can do a BARC 10 with somebody, say that within the first 30 days that they're coming into the center, and then do another one at 6 months, you can see hopefully, that score will increase, that individual is indeed, building their recovery capital. And that is a great way to show that what you're doing has that impact, that people are able to improve their health and wellness. I have about 4 minutes. I only need 2 minutes of it, but I want to finish up telling a story. It's so effective to be able to talk about data, but yet tie that into a story, because stories are the way that we can really change hearts and minds. And we can really change the perception of recovery and of individuals that are seeking recovery and that are in recovery, and what that looks like. So I want to tell a story, and I'm going to read it kind of verbatim from one of our managers. So this happened in early July, and we had just reopened our centers at that time. And one of the RCC staff had this in her report. So she said, Ather came in sobbing Friday morning. She was very distraught. She had come to the center a few times back in February and March, but she was never really involved. She had an incident at her IOP and said she was riding the bus, not sure where to go, when she saw the lights on in the center. I spent a few hours with her that Friday, helping her with numerous things. She had been housed at the local hotel until 6:30, June 30th. At that point, she and the others were sent to the no-freeze shelter where they were given tents. Somebody robbed and destroyed her tent the night before. Her phone, medications, and all of her clothing were taken. She needed to call her probation officer, but didn't know his name. She is a refugee from Sudan, and English is her fourth language. She speaks it fairly well, but can't read or write it. I emailed another probation officer and gave him my approximation of the name that she had given me. He was able to connect us with him. She spoke to him and explained what happened. We called her medical provider, who then called in her prescriptions for refill. We called her case manager and to talk about her housing needs. Her case manager was able to explain to me, and then I explained to her the status of her housing, voucher, and placement. I talked to her about local resources for replacing her clothing. And we also called Eduardo from the Nose Freeze shelter. She was extremely thankful, and her case manager was able to get funding for a replacement tent. At 4 p.m. on Friday, she ran into someone she knew from last year. The woman had a car and said she could stay with her for the weekend. She is scheduled to see her case manager first thing Monday morning. I'm sharing this with you because this really illustrates to me, some of the things that we do at the center that kind of go unnoticed. This woman was on the bus. She was distraught. She didn't know what to do. And she saw the light on and she came in, and we were able to really kind of provide her those services that she so desperately needed. And we were able to do that because, number one, we were open, and number two, we were connected to the community. So that's all I have, everybody. Thank you so much.
Thank you. That was an incredibly powerful story, and I think illustrates so well the complexities and what you're saying, that really being at the intersection point between somebody who needs help and doesn't entirely know how to do it, and you being in the community to make that linkage and to make that happen. And that's incredible. Thank you for sharing that. What we do have, and this is sort of like a theoretical exercise, because we do have scientists in the room, and we talked earlier about how do we document impact, how do we convince others that this works, and how do we show it. There's a number of measures that you see here. we have a little polling question for you, Hazel, if you can go to the next slide, I think, which is where we have it. And this is just for us to think about. What we would like you to think about right now and give us an answer for is to say, if you had to pick one best measure of an RCC's impact, and I think we all know that there's so many different levels and so many different ways, but just as a theoretical kind of exercise for us to think about, here are some options that we came up with. And if you guys can think about it, is it the number of people who are coming through the doors? Is it the hours that people spend? Is it the proportion of folks who come through the door who sustain non-problematic substance use? Is it the proportion of people who are satisfied with how they're progressing for recovery? Is it something like the BARC-10, taking a scale like that and getting a higher score from 30 days versus 6 months? Is it quality of life that is increased? Or is it the proportion of people who are attaining some concrete goals, housing, job, particular educational attainments, promotions, custody of kids, those kinds of things? If you guys can think about that and just kind of select the best, and then if you have other ideas, tell us about it either in the chat or by emailing us and saying, this is a dimension we are not measuring and we really need to, that would be great. And then after we're done with that, and actually while we are thinking about this and doing it, please ask any questions of Phil, Rebecca, and Brian that you have about how things are going at your center and what you think are the most powerful things and anything that has sparked during this discussion. I'll open up for you guys to ask questions. So I see here a comment about functional outcome measurements. Ginger, would you be willing to speak more about what kind of functional outcomes? And then we also have RCC impact and sustained recovery and long-term use.
Are people able to unmute themselves?
They should be. So there should be in the bottom left, there's a little microphone with like a green wavy line. And if you click on that, hopefully that works for you, Ginger. And otherwise, Hazel, can you unmute Ginger for her? I know it takes a little while to scroll through it.
I'll just have to find her.
Hello.
Hi.
Hi. Sorry it took me so long.
No worries.
Yeah, so for functional measurement outcomes, what I like to look for is a measurement of them achieving their own tasks. And for example, what that means is if they come into the recovery center with the inability to obtain a job or gainful employment, what does that process look like for them to get employment? And through the recovery coaching, have they been able to achieve sustainable employment? Similarly, if some of their barriers to recovery include maybe outstanding warrants or criminal justice involvement, are they able to navigate within the system to eliminate those barriers and improve their quality of life? So another example might be the ability to gain stable housing. And defined by them, what does stable and safe housing mean to them when they come into the recovery center, if they are sofa surfing or if they are houseless, and within 90 days or 6 months, they now have sustained housing. That's a functional outcome measurement that I feel really speaks to the effectiveness of the peer recovery coach.
Mm-hmm. Thank you, Ginger, so much for sharing that. Those are great points.
You're welcome.
Do we have the polling results by any chance? You want to just share them? And I know it's a multifaceted thing, so it's sort of like, I don't want to say it's a trick question, but we're trying to figure out also the front runner is quality of life. Here we go. Which, of course, all of these things are tied in together, right? Into that. Very cool. Is there something on this list in addition to these other functional outcomes that you've mentioned that's missing, that other ways? So if you had to run a study and say, you show your center's impact, what would you want to show to your funders, to the community, what you can do? Is there anything else here missing that we should have on here?
Hi, I'm hoping I'm saying this correctly. My name is Ray Barton from Step First Recovery Support Center. I would say that, what do you think is the best measure of an RCC's impact? If we could show how we address people culturally and spiritually where they're at, if we were respectful and receptive of people's ethnic and backgrounds and experiences. So I would include that.
Great, important point. And we've talked about a little bit within our steering committee about how recovery takes place, and recovery support takes place in different places. And churches is one place that we don't talk a lot about, but there certainly is a lot of recovery support happening there as well. So we hope to talk to that point at some point a little bit more as well. And spirituality, of course, is so important to so many, but so different for all. So these are great points. Thank you, Laura. I'm hoping saying your name correct, Laura. Thank you.
Bettina,
Perfect.
I would, but one of the things when looking at this list, these are all internal. And one of the ways we well, it's anecdotal, but say in Hartford, the center that Dr. Kelly came down and visited, it was known as the recovery place. And so we don't have any measures about how well known the Recovery Community Center is in the local community. And do people access it? Do they know what it's about? And I think that's important too, because that ties into the idea of recovery being contagious, carrying recovery. And if we can't that's why we like to have our centers on the street, that people can see them. They're visible, they're vocal, they're right there. So does the community know about us?
Mm-hmm. Right. It's, the lights on, you can't see the lights on if it's not somewhere where people are passing by. And if you don't have people spreading the words, talking about it, then others can't find it. Right. Mm-hmm. So that, I think, is challenging to measure, but incredibly important. Mm-hmm. Mm-hmm.
I think also, this is Ginger Ross again, it's important to measure unification and reunification with families. Mm-hmm. I think that's a really strong indicator of recovery is possible and that recovery coaching works. There's some states that are incorporating recovery coaching into their child welfare offices, and they're having incredible outcomes with that, with the support, the added support. In addition to the support that they're offering those in recovery, it's also helping to remove stigma with the child welfare workers. So it really has a multifaceted benefit, but I don't think we have a measurement for that anywhere.
Mm-hmm. You're right, we don't. But it is, it's a critical piece. Regaining custody, reuniting with family members. So we oftentimes talk about social support, but this is different. This is family, right? This is connecting with your family again. Right. Great point. I love it. One thing that we also talk about in one of our future seminars, we will be talking about more concretely, is this linkage with healthcare, which is another way of just letting people more know and connecting directly with resources, spreading the word in different ways. And I know you guys at CCAR, you guys are working very closely with the healthcare system and the centers in Connecticut. Is that the experience for many RCCs? You guys are from different parts of our country. How does that work for you guys? Is that a good way for you to be more visible in the community, or are you doing less with healthcare systems? And Phil, Brian, Rebecca, do you want to talk about why and how you started working with the healthcare systems?
Of course we would. We always like to talk. I'll turn it over to Rebecca to talk about how our emergency department recovery coach program aids to the recovery community centers. But the other thing to measure is we talked about culture. And I don't even know you, Lorraine also talked about this, but what's the welcoming when you walk into a center? Do people, like Brian talked about, when he first went in, is the culture recovery friendly to all pathways? Does it represent the community and the people there? What do they see on the walls? How are people treated? Dignity, respect. So we have to really think about if we were put ourselves in the shoes of the people coming in, and would we feel welcome here? And I think, well, I'll leave it at that. And Rebecca, go ahead, jump in.
Thanks, Phil. Yeah, so we are going on 4 years of a program where we're sending recovery coaches into the emergency departments. And we started with 4 hospitals back in 2017, and now we're in 22 hospitals in Connecticut. And one of the things that is so incredible is that, you know, when you think about that experience of going into an emergency department as a result of, you know, an overdose or other substance use disorder crisis, that is the entryway, or that can be the entryway for somebody to initiate their recovery, and to have a recovery coach there to sit with them and to you know, talk to them and encourage them and stuff has been incredible. But one of the great things is they're also able to you know, be invited to our recovery community centers and to get involved. And you know, I have you know, dozens and dozens of stories over the last 4 years of individuals, you know, meeting one of our coaches in the emergency department, and then coming into one of our centers and getting involved. And, you know, and there is a small number of these individuals that we've actually hired, you know, that are now part of our staff and that are themselves recovery coaches. So how do you measure something like that? It's incredible. But I'll leave it at that, since we are very, very close to the end of this meeting.
Yeah, that was perfect. Thank you. Thank you for that feedback. All right, I think we have one last minute for any questions from you all. Now I see the contact information if you want to get in touch. And I do want to say thank you so much, Phil, Rebecca, and Brian. It's been great, and thank you for sharing the stories, your insights, and your know-how on how to do this and how to do this so welcomingly and wonderfully.
Yeah, I just say thank you again, Phil, Rebecca, Brian. Thanks so much. Just so inspiring, as always. One of the things, you know, in terms of measuring the kind of the atmosphere dimensions is the social climate. Sometimes it's referred to as the social climate. And Rudy Moose from Stanford, who was one of my mentors years ago, he's developed these social climate scales, which are kind of quick measures, validated measures to measure dimensions of kind of cohesion, involvement, personal growth, these kinds of things, to the extent to which those environments, those social climates support and help that along. So that might be something that we could look at as bringing into measuring those very important dimensions, because that's kind of the air that people breathe in those places. Mm-hmm. Yeah.
All right, then I think that we are officially out of time. We will be sending you all an email. If you've given us I think there's 3 times you have to enter your email on the Zoom registration form, unfortunately. But if you're already on our mailing list, you'll already get it. We'll send you an email as soon as we have our slides and the video recording available, so you guys can send them to friends, to other folks, and enjoy them yourselves again. And as always, we're open to feedback from you. Check out the materials regarding pilot funding and conference travel. And we will see you again, hopefully in a month, for our next talk. So thank you so much for being here and for sharing this with us.